President and CEO of Monterey County Business Council. We're going to start with Supervisor Alejo. If you could just for a minute say some welcoming words.
Thank you, Veronica. Yes, I'm certainly proud to be here holding these first virtual town halls on student vaccinations before any other county on the Central Coast. I want to thank all of our partners, including my colleague Supervisor Wendy Rudascu, Salinas Mayor Kimberly Craig, Natividad Hospital, the Monterey County Health Department, and the Monterey County Office of Education, and certainly KION and Telemundo for helping us really get the word out about this important town hall. Monterey County declared health misinformation a public health crisis, and we know that student vaccinations are on the top of the mind of thousands of parents in our county, as our children are our top priority. So we were very intentional in coming out early with this town hall to get accurate information out to our parents as soon as possible and answer their questions. We know that on October 1st, Governor Newsom announced that California would be the first state to institute a student vaccine mandate. Today, 95% of California students have returned to in-class instruction, and California students are 12% of all students in the United States. But today, we only account for less than 1% of school closures across our country. So our state has among the lowest rates, but we're doing the right things. We're wearing masks, washing hands, social distancing, and now moving to vaccinate our students in the coming months. So we want to keep protecting our children, our families, and our communities. And I'm proud that you all have joined us this evening. Thank you. And I'll pass it to Supervisor Wendy Rudascu.
Thank you. And thank you all for joining us tonight. I am the mom of a 9-year-old, and I can tell you that as a parent, we have sacrificed so much this past 18 months. Our children have sacrificed school, they've sacrificed play dates. I've sacrificed the village of support that I rely on as a parent. We've all worked so incredibly hard to keep each other safe, to keep our elders safe, and to keep our children safe. And we're so close to this next big step. We're so close to having these vaccines be available for our 5 to 11-year-old children. And I just want to encourage every mom, every dad, every auntie, and every grandparent, every caregiver out in Monterey County to show your love, show your care to our children by talking to their doctor, reaching out to talk to one of our county doctors if you have questions. And when the time comes, let's get our kids vaccinated so that we can move beyond this pandemic, so that we can keep our schools open, we can keep our kids learning, we can keep moving forward as a community. Monterey County has been phenomenal. We've exceeded 80% vaccination rate for those who are currently eligible. And I believe that when vaccines become available for our youth, that we're going to exceed those numbers for our kids in no time. So thank you so much for joining us. Keep learning more. And if you have questions, talk to a doctor to get your questions answered, and we can move forward as a healthy community.
Thank you. Salinas Mayor Kimberly Craig.
Thanks so much. And thank you to my colleagues, Supervisor Alejo and Askew, for asking me to be present today. You know, what I will just share with you is when I was elected in December, within 2 weeks, I got COVID, and it was not fun. And certainly recognizing vaccines becoming available and en masse, it's just really important to have those conversations. I think we're all over it, you know, at this point. And really, the more we work to get everyone vaccinated, children included, I think the faster we can get through this pandemic. And so Salinas was the city with the majority of the cases within the county, but we're also the city that has the greatest vaccination rate. I certainly recognize there's a lot of apprehension about vaccinating kids. And so I'm just thrilled to have the doctors, the experts here on the call today to be able to answer your questions and concerns. So feel free to ask whatever you need to ask in order to get to a point where you feel comfortable with your next steps with your children. So thank you.
Thank you, Mayor Craig. Well, of course, like I said, we have our panel of health experts joining us, and also Public Relations Officer for the Monterey County Office of Education. Dr. Edward Moreno is the Monterey County Health Officer and Director of Public Health for Monterey County. He's a graduate of the University of Notre Dame. He earned his medical degree from the University of California, San Francisco. We also have Dr. Christopher Carpenter. Dr. Christopher Carpenter is Natividad's Director of Pediatric Services and Chief of Staff there. He taught pediatric medicine at Harvard Medical School. And lastly, we have Esmeralda Owens, who's the Communications Public Relations Officer for Monterey County Office of Education. She has a vast experience as a journalist, also in marketing and public relations. So we're now going to let our panelists share what they know about student vaccinations, and we'll begin with Dr. Edward Moreno.
All right, thank you very much for that introduction. Good evening, everybody. I'm just going to give a little bit of a update on the vaccination progress here in Monterey County, and then the status of vaccinations for our school-age children. So we do have approximately an estimated 83% of Monterey County residents that are over the age of 12 that have received at least one dose of a COVID vaccine. And according to the state vaccine database, approximately 75% of that eligible population has been fully vaccinated. So we're doing fairly well. That's close to the state average. So I think we're doing well with the vaccination of our folks in Monterey County. As far as the status of the population that we're discussing today, that's our school-age children. Among those that are 12 to 17 years of age, we have an estimated 76% of those children receiving at least one dose of COVID-19 vaccine. And as a vaccine providers here in Monterey County that provide vaccinations to children under the age of 18, we know we need to get consent from parents to give that vaccine. So this 76% really is a reflection of the willingness of parents in Monterey County to step up and recognize that there's tremendous benefit for the children and for their family members to get the kids vaccinated. So I'd like to congratulate all those parents who have stepped up and given their permission for a vaccine provider to go ahead and vaccinate their child. As far as the 5 to 11, that's the newest age group that's being considered to receive a COVID vaccine. So where we're at is things have changed since just in the last week. Earlier this week, the committee that advises the Food and Drug Administration, or the FDA, they met and they voted to recommend that the FDA authorize the Pfizer vaccine, and in a smaller dose, as a 2-dose series for children ages 5 to 11. The CDC, Centers for Disease Control and Prevention, they also have an advisory committee. So they'll be meeting, I believe, next week. And it is expected that they'll have a very good conversation among experts who understand the clinical trials and the studies are surrounding COVID vaccines among the pediatric population. And they will most likely be, we anticipate they're going to be discussing similarly, potentially recommending that the CDC also recommend the use of the Pfizer COVID-19 vaccine for children ages 5 to 11. And finally, there is a group called the Western State Scientific Safety Review Work Group, and they have also been meeting to review FDA recommendations and CDC recommendations. And they will be meeting, we expect them to meet as well. And again, we anticipate that they'll be considering making a recommendation to the California Department of Public Health on the use of Pfizer COVID-19 vaccine among children aged 5 to 11. So those are the committees that each of them is packed with experts from across the country and objectively review the data on the clinical trials, the outcomes, and weigh the risks and the benefits in making a recommendation for expanding the use of COVID vaccines among the younger population. So the next steps, if the emergency use authorization is granted by the FDA and the other advisory committees in the CDC and CDPH agree on expanding to the use of COVID-19 vaccine among 5 to 11 individuals 5 to 11 years of age, then we anticipate that the vaccine will be available and provided by vaccine providers here in Monterey County sometime in November. let's see, where are we? With regards of acquiring the vaccine for this new pediatric population, there are some vaccine providers here in Monterey County that have already pre-ordered the vaccine. So basically the Centers for Disease Control and Prevention now have an idea of where the interest lies in Monterey County and in California for receiving vaccines. So those are pre-ordered, they haven't been delivered. And we believe that when there's an emergency use authorization and recommendation that comes out, we anticipate that the doses will be shipped to those that have ordered. There are approximately 12,600 doses countywide. So we did take advantage of the full allocations that were afforded to Monterey County vaccine providers. And so those will be arriving we anticipate about 3 shipments to vaccine providers. We have received some reassurance from California Department of Public Health and the CDC that there should be, with this process in place, pre-ordering and getting ready to deliver, there should be, hopefully will not be supply shortages. And following these initial shipments, we anticipate that vaccine providers will be able to resume placing orders on a weekly basis, with new vaccines arriving every week shortly after their orders go in. I've been asked how many children fall into the 5 to 11 age range here in Monterey County, and we have an estimate of just a little over 43,000 children that fall into this age range. Let's see. So I would suggest that parents of school children in this age group continue to follow the news to find out when the vaccine is available, and we will be working with our public information officers and others to get the information out so parents are aware of when the vaccine is available and who's providing the vaccine here in Monterey County. I really do encourage parents to get their kids vaccinated. The vaccine is the most important and most effective strategy that we have to reduce the spread of COVID-19 here in Monterey County and here in California. This includes not just children, but also encourage people who are adults to receive the initial series if they haven't already received it. If they haven't received the initial series, to receive an additional dose, which is recommended for people who have a weakened immune system, and also receive a booster vaccine if you fall into certain criteria. I'll just end with let you share with you what we're doing here, specifically in public health in the health department. We continue to play a key role in administering vaccine to the community. Our public health clinics, which move throughout the community, have administered over 5,000 vaccines to our kids aged 12 to 15. And our county health department clinics have administered over 3,000 vaccines to their pediatric patients aged 12 to 15. And we continue to encourage primary care providers and other vaccine providers to begin to place their orders and begin to get ready to receive the vaccine and offer that vaccine to their pediatric population as soon as possible after the emergency use authorization. So that is my overview. Thank you very much.
Okay, thank you, Dr. Edward Moreno. And now we'll go to Dr. Christopher Carpenter with Natividad.
Great, thank you very much. And thank you, Dr. Moreno, for your fantastic leadership through this. It's been an honor to be able to work under you. My name is Chris Carpenter. I am the Pediatric Service Director at Natividad. Before Natividad, I did 17 years of training to become a pediatrician. And after my training, I worked overseas in the Congo and Haiti, so very underdeveloped areas, and then had the honor of coming back to the United States with my 2 children and made roots here in Salinas. And I've been in Salinas for over 5 years and the service director in pediatrics. And most importantly, I am a dad. I'm a dad of 2 10-year-olds, and I am quite excited to be able to bring them to our pediatrician and get the COVID vaccine so I can protect them and my community. I have no financial interest in vaccines. The only interest I have is keeping my patients and my community safe. So I want to give a little background about pediatrics and COVID. We have seen over the last 19 months that from newborns all the way to young adults can carry the virus and can spread it, either symptomatic or asymptomatic. And we've seen over 6 million children test positive for COVID. And that is just under 2 million children that are in the age range of 5 to 11. We've seen over 23,000 hospitalizations and just over 8,000 hospitalizations in the ages of 5 to 11. And we have unfortunately seen nearly 700 deaths in children due to COVID, and just about 140 deaths in children aged 5 to 11. And over the last many months, we've been seeing that children are susceptible to what we call long haul COVID. So symptoms that continually manifest for many months and could potentially for many years. So we've had, many people have heard about the trials that we have had for the vaccine. We initially had trials for young adults, and those were many thousands. And then we had trials for children that were 12 to 15. And then we have had trials from kids 5 to 11 that are currently being reviewed. In these trials, we had over 2,000 children, a little over 1,500 received the vaccine. And we saw that they had an excellent immune response. So their antibodies, the little things floating around their blood that fight off the infection, was very good. And the vaccine was 91% effective in preventing symptomatic infections. So I often get asked about the vaccines and why should we trust something that has come out so quickly? This vaccine, mRNA, is not new technology. Research started in the 60s and 70s, and really good clinical trials started years ago. And then when we started learning about the virus in late 2019, early 2020, a lot of money and time and research was put into the making sure that this was safe and effective, more so than any vaccine in the history of the world. We have seen that the vaccine is effective 93% in preventing hospitalizations in adolescents, and like I mentioned before, 91% in children 5 to 11. We have seen that hospitalization is 10 times higher in unvaccinated kids. And the corollary statistic is of children that are hospitalized, 97% are unvaccinated. And if we look at children that were hospitalized in our pediatric ICU that are on life support, breathing machines or medications to help their heart go, all of them have been unvaccinated. And last that we know that kids and adults that get COVID, that get the vaccine after they had COVID infection, are 2 times less likely to get COVID again. So the COVID vaccine is more protective than just having the virus itself. So lastly, how do we know it's going to be safe? So we've seen safety data from the trials, and we've seen over 13 million children between ages of 12 to 17 that have been vaccinated over the last several months since May. And we have seen the trial for the kids age 5 to 11. There are common side effects. We see side effects, pain, they can feel tired, headachy, have some muscle aches. These are usually mild and they go away in 1 to 3 days. I get asked frequently about the myocarditis. Myo is heart muscle. Myocarditis is inflammation of heart muscle. And that has been a concern of many parents. We have seen that children in their late adolescence and early adults are more likely to get this very rare side effect, but it is still extraordinarily rare. In those populations, we are seeing about 40 per 1 million vaccine. So that is 40 to 60 cases of heart inflammation per 1 million vaccines. These children are generally given medications that are called anti-inflammatories. They have a mild case of myocarditis and they recover fully. I am estimating the trial of the children 5 to 11 did not show any cases of myocarditis. And given the history of other vaccines, the adolescents are more at risk for myocarditis. I believe that the children 5 to 11 are going to be much less likely to develop this very rare and mild complication from the vaccine. And lastly, I think there's a great statistic that we see that per million doses of vaccine that we give, we will be able to prevent over 10,000 COVID cases in children, 560 hospitalization, prevent almost 140 ICU admissions, and prevent 6 deaths. That's per 1 million doses of COVID vaccine. So I am very confident in the science behind this vaccine. I'm confident in the committees that have reviewed the research and the data. And I am confident and plan to get my kids vaccinated as soon as they are able. I look forward to questions. I greatly admire parents that are trying to investigate and learn as much as they can about this. I love to have questions, and I love for parents to be inquisitive, and I look forward to answering questions in a few moments. Thank you.
Thank you, Dr. Carpenter. And lastly, we have panelist Esmeralda Owen with the Monterey County Office of Education. Esmeralda.
Hi, good evening. I'm glad to be here to talk about vaccines for K-12 students. And Superintendent of Schools, Dr. Dominguez, regrets not being able to be here today, due to a previously planned trip. She had hoped to join in, but her internet, it's kind of unsteady, so she asked me to step in. So I think that after hearing from the medical community, there's a great deal of evidence that vaccines are safe and effective in preventing the spread of the virus. So let's talk first a little bit about the vaccines that are currently required by schools and what is to come potentially. And as we know, we have a group of 5 vaccine groups required, which include, among them, tetanus, pertussis, polio, hepatitis B, measles, varicella, and others. Governor Newsom has announced a plan for the state of California to add the COVID-19 vaccine to the list of vaccinations already required to attend school in person. The plan states that upon FDA approval, full FDA approval of age groups within a grade span, California Department of Public Health will consider the recommendations of the Advisory Committee on Immunization Practices of the U.S. Department of Health and Human Services and the American Academy of Pediatrics and the American Academy of Family Physicians prior to implementing a COVID vaccine requirement for public, charter, and private school students and school employees. So an approval, for vaccines, 5 to 11-year-olds could come as early as November. So it could be next month, which is next week. The requirement would take effect at the start of the term following the full approval of that grade span to be defined as January 1st or July 1st of 2022, whichever comes first. And how will this mandate impact schools, and how will the requirement be managed? So schools will be reaching out to the parents to notify them on the mandate once it comes into effect, giving them plenty of notice so that students can get both doses in time to be fully vaccinated before starting school. Schools also will be required to collect COVID-19 immunization records, just as they do with other immunization information. It's important to remember that parents may request an exemption for medical reasons or personal reasons as per the Health and Safety Code section 120338. So the greatest impact is that a successful implementation of this mandate will prioritize student health and safety, allowing us as a community to continue safely with in-person instruction. MCOE is reaching out to pharmacies in our county and school districts that are interested in hosting school site vaccination clinics so that parents and students can have easy access to these vaccinations. Actually, the question that we get the most from parents and principals and other superintendents are telling us is like, when is the vaccine coming? When can we have our children vaccinated? So we want to make it as easy as possible for families to have a clinic right there accessible. So just in case also if they have challenges with transportation. So we are working already and getting prepared. And why should students get vaccinated? Vaccines help prevent the spread of serious illnesses and hospitalization and further protect students and staff in supporting a safe return to in-person instruction. The more mitigation strategies implemented, the safer our students and staff will be. After students are vaccinated, they can more safely resume their normal activities and that we had in place before, or they had in place before the pandemic, like field trips they cannot do right now, for example. And also, if students are vaccinated, they are less likely to get COVID and spread it to their loved ones. So MCOE is currently partnering with local healthcare agencies and pharmacies in preparation for this approval. And as soon as this happens, we will let the entire Monterey County Office of Education staff, teachers, parents, everyone know of what are the next steps in getting their children vaccinated or accommodating those who select not to.
Wonderful, thank you. Okay, with that, we're going to be opening this town hall to questions now, and those can be submitted through this webinar and also Monterey County's Facebook and YouTube pages. Already some questions have started coming in, so I'm going to select here, and then I guess our panelists can raise their hand and decide who answers. I'll start with this question first, because I've seen it more than once here. So the question is, why is it a priority to get this age group, our children, vaccinated when they have a higher rate of recovery?
So I can go ahead and start. Yeah.
Okay,
so,
thank you.
Okay, sure. So we know that individuals who are unvaccinated are more likely to get COVID-19. And they're more likely to spread it, meaning they're more likely to be infectious. And so one of the things that we're really trying to do here in California, in addition to trying to reduce the spread of COVID and reduce the cases and reduce the hospitalizations and reduce fatalities, is trying to do our best to get back to the way and to get back to I want to say the way things were, but don't know if we'll actually get there, but get back to closer to the way things were. And that one of those includes having kids in classrooms. And so we know that kids really struggled over the previous academic year when they were trying to learn from home. Parents were babysitting, schooling their kids, tutoring their kids, trying to work. It's very, very challenging. So it's much better off. We know that the kids are much better off in school. Families and parents do much better when the kids are in the classroom socializing and learning in person. So one of the things that in order to get kids in school, now they're in school and now we want to keep them in the classrooms. We really want to make sure that if the evidence shows that the benefits to this age group outweighs the risk, we really want to get these kids vaccinated. As mentioned earlier, this will prevent kids from coming down with COVID. Even if it's a mild case, if a kid gets a mild case of COVID, they're out of the classroom. So we want to keep the kids healthy and in the classroom because they will do much better once they're vaccinated and they remain healthy and they remain in the classroom.
Does anybody want to add to that, or should I go on to the next question?
That was a great response.
Okay. The next question is the trial data released and is it available to the public? They don't give a specific age group, but I'm guessing they're talking about 5 to 11.
The trial data for the 12 to 15 has been released. And not all of the trial data for the 5 to 11 has been released. We have gotten quite a bit of information, in particular the 97% effective rate, and some of the data on the antibodies, but over the next couple of weeks, much more data will begin to come out.
Okay, thank you. Another question we're also getting more than once here seems to surround a liability issue, concern for side effects. One parent asking if there is a chance for facial paralysis, which we saw earlier with, I forget what drug maker, they didn't mention it, but I remember hearing it in the news that there was one drug maker, with the side effect with that vaccine was facial paralysis. So this parent wants to know if that has been seen with any of the trials in children.
So again, the major side effects that we have seen are the ones that come right after the vaccine: arm soreness, fever, fatigue, and headaches. And the serious side effects have been very minimal. And the one that has made a lot of news is the myocarditis. And again, the trial for 5 to 11 for myocarditis saw no cases. And in the older age range, we were about between 40 and 60 per 1 million doses. The trials, we did not see facial paralysis for our pediatric patients.
Okay, there's another parent who's also asking the difference between emergency use authorization, which is expected soon, we know, and also full FDA authorization. And if there's a difference here as far as implementing the requirement for the vaccine.
I could talk about that. The emergency use authorization is initially granted by the FDA for a medication or drug or vaccine that is required in emergent situation. This was initially done for adults and then was done for our 12 to 15-year-olds in May. And that is what the plan is to be granted for our children from 5 to 11. Emergency use authorization is not full approval. Our young adults have been granted full approval. Our 12 to 15 are still under emergency authorization, but the paperwork has been submitted for the full approval. And we are still many, many months away from potentially having full approval from the 5 to 11. So the emergency authorization is just the ability to start using this under an emergent situation, and it is not full approval for that drug or medication.
Okay, Esther Rios says, why would children get vaccinated if they are the lowest group to spread it and there is a low chance of them dying from it?
So I'll take that one. I'll start off. So again, we do know that children, if they do get COVID, they're less likely to be hospitalized or suffer serious illness compared to older populations or populations that have chronic medical conditions, underlying medical conditions, or people who are immune compromised. So we do know that. However, children can still spread it, and children often live with family members who are a high risk for serious illness. They live with they live in multi-generational homes. We have grandparents, great-grandparents, often babysitting these kids after school, and providing, and often they're the primary caregiver for these children. And so if a child doesn't get vaccinated and gets COVID, even if it's just a little runny nose, little cough, they could give that to an older adult who has not been vaccinated, or even if they've been vaccinated, if the immunity is starting to wane over time, they might become more susceptible. They can infect the older adult or the person susceptible, who could then come down with serious illness. So we really are looking for for the evidence that's being presented through these advisory committees, that it's safe to give to an expanding group of individuals which now includes the 5-11-year-old, by protecting a larger proportion of the population. We're also protecting those individuals who are most likely to get serious illness or hospitalized or die from COVID-19.
Another parent is asking about finding a provider with the vaccine, and also how different is this child vaccine versus the adult one? One last question from this parent. So I say 3 questions in one. Are we allowed, because we saw this early in the pandemic, are we allowed to go to another county to find appointments there?
Okay, I can start from that one. So there are different ways to find a vaccine provider who will be vaccinating the currently eligible population, and hopefully soon the 5 to 11-year-olds. So the state of California has a portal, a web page called My Turn, and people can go to that and put in information. And if there's a series of web pages that will pop up based on responses, and determine if they or the person or their child are eligible for a vaccine, and which vaccines they're eligible for, and which vaccine providers are providing that vaccine. So that is something that we're getting reports from the state, from California Department of Public Health, getting updates on the progress that they're making to make sure that that is up and running, functioning properly when the authorization comes out and vaccine starts to arrive at vaccine providers. In terms of, and the other thing is, I believe that we still, are still working with the Monterey County 211. They have information that is being updated, where someone calls in and asks questions about whether they can get a COVID-19 vaccine for themselves or a family member, or even if they need assistance making an appointment. 211 can either assist with actually scheduling an appointment, or 211 is also aware of vaccine providers that don't use the My Turn. They have their own system in place where people are encouraged to sign up for an appointment. They can assist that person to get to that website, use that portal, and make their appointment. And finally, I do believe that individuals that, for whatever reason, decide that they want to get a vaccine for themselves or their child in another county, I think that's still hopefully will be an option for them. It's a good question, and I'll look into that.
Yes, and if I may add, I know we are working with different agencies, and we have Soledad Community Health District, who has agreed to be one of those sites to provide vaccines or youth vaccine clinics, and that would be Soledad down to King City and beyond. And then we have Safeway stores who are going to be also clinics, in Salinas and in the peninsula. And besides these, we are also signing up other schools, in different areas in the county who will also have these clinics. So we're going to make it as easy as possible for parents and students to get the vaccine. And as soon as we're able to, we're going to start to, to roll that information out to everyone, so they don't have to go to another county, and they can just go maybe down the street.
And the dose for children 5 to 11 is going to be 1/3 of the adolescent and adult dose. So it is 10 micrograms, and the dose for adolescents and adult is 30 micrograms. So it is 1/3.
Here's another question I found interesting too. And as a parent, I have this question myself. How do you deal with spacing out the vaccine, spacing out the flu vaccine with the COVID vaccine, along with any other vaccine that's due for your child?
I'll go ahead and answer that one. So there may be some concern about dosing COVID vaccine with other vaccines, and I think that goes back to early on when COVID vaccines were first recommended by the CDC. And I'll try to make this real quick. The FDA, when they issued the initial authorizations, did not restrict the administration of COVID-19 vaccine with other vaccines. However, the CDC, out of abundance of caution, did suggest that as the vaccines were first coming out, that vaccine providers not give the COVID vaccine with other vaccines. We were required to dose, have to wait at least 2 weeks after one vaccine before you can give COVID-19, and then wait at least 2 weeks after the COVID-19 vaccine to give another vaccine. So since then, the CDC has dropped that recommendation and actually encourages vaccine providers and anyone looking to get a vaccine to, as we head into flu season, if they're getting their primary series of COVID vaccine or their additional dose or their booster dose, to go ahead and request the flu vaccine or look for providers for providing both vaccines at the same clinic. So we do encourage people to take advantage of the time they're taking out of their from work or from other responsibilities. They're taking that time and going to get vaccinated, make the best use of your time and get your COVID vaccine and as well as your flu vaccine.
I know earlier we had heard the Monterey County Office of Education say that they have received this question from parents already, but if someone can address it here, one parent is asking if their child already had COVID and have the natural antibodies, why should they still be vaccinated? That's from Santana, Amasquita.
I can take that. When you have the virus, you do have what is called natural immunity. But there have been studies that have shown that after you have the virus, if you have the vaccine, that immunity increases. And there was a really good study that showed that 2.3 times more immunity or more protection with the vaccine after having the virus. So we still believe strongly that getting the vaccine after having the virus is the best course of action. If you have the virus and you are treated with antibodies from the hospital, so those are antibodies that we can infuse, you do have to wait to get the vaccine. But if you just have the virus and are not treated with these special antibodies, you can get the vaccine and that will help protect you going forward to not get the virus again.
Thank you. Supervisor Wendy, we ask you, I believe you asked this question, can I get my adult booster shot at the same time when I get my child their vaccine?
I have heard that in some of these clinics, they will have also booster shots available for the adults. Right now, actually, in some of the clinics that I've heard about, they are providing the booster shot and the flu shot at the same time for adults. So yes, that's the plan.
I would like to say that all of the pediatric vials for 5 to 11-year-olds, those are going to be separate and separate dosing from any adult vaccinations. So there won't be any confusion or cross-contamination. So all of our children 5 to 11 will get 10 micrograms and they will not be exposed or potentially getting the 30 micrograms.
Yeah, thank you for bringing that up, Dr. Carpenter. As a matter of fact, I believe the vials look different and the tops are different colors to help the providers distinguish the difference between the adult doses and the 5 to 11 doses.
Okay, this parent is asking about herd immunity. If it could be explained, at what point do you believe it will be reached in Monterey County? Is an unvaccinated child more likely to spread COVID-19 than a vaccinated child? If so, how much more? And also they're asking, what are the long-term side effects from the vaccine?
What was the first question again? Sorry.
So they start off by talking about herd immunity. I think the idea here is that if there's enough people getting vaccinated as far as adults and older age groups, are we anywhere closer to herd immunity, and does that still require children to be vaccinated? And I guess the second part of their question is, what are the long-term side effects with the vaccine?
Okay, I'll start with the herd immunity portion of that question. So the idea of herd immunity is that when a population, when you don't have herd immunity, that's a population where most of the people in that community or that group have no immunity to a virus or bacteria, something that causes disease. And if one person in that group gets infected, they expose someone else in that group, that person doesn't have immunity either, so they could become sick. And they infect one or more people, and those people infect more people. And so you've got an outbreak, or in this case, what we're experiencing is a pandemic. Herd immunity refers to a phenomenon where the majority of people actually have immunity. And in this case, we've achieved a lot of immunity in Monterey County in California through vaccination. So with herd immunity, the idea is that if one person gets exposed in this group, if they're immune, they're less likely to get sick and spread it to somebody else. If they happen to get sick and spread it, they're more likely to expose someone who also has immunity, which means they're unlikely to get sick. And so you either slow down the spread, or you basically terminate the spread in the community if you have herd immunity. I will say that with this pandemic, with this COVID pandemic, we're still learning a lot from it. There are variants that have come out, and there's always new variants that are emerging globally. And because of particularly because of those variants, it would be difficult to say when we'd reach herd immunity, because even though we may have a high proportion of people who are vaccinated or have some immunity, a new variant may present that people who have immunity maybe are less likely to get sick, a serious illness, which was what the vaccines do, but they may still spread the virus. So it's going to be really difficult to say when we might have herd immunity. The other thing is there are some people who want to rely on herd immunity because they don't want to get vaccinated or don't want to vaccinate their children. And the idea there is, well, if my child is the only one that's not vaccinated in the classroom or at school, they're probably not going to get COVID because no one at school is going to get COVID. Again, we don't know enough about this virus to that anyone should rely on herd immunity for not vaccinating themselves. And we should remember that there are parts of the United States and other countries that have much lower vaccination rates, where many more people are becoming sick and spreading COVID. So someone who's not vaccinated and relying on herd immunity, they may want to travel, and they may want to go outside of California where there's lower vaccination rates. They may want to leave the country and visit a country that has low vaccination rates. And if they're unvaccinated, their risk of getting COVID and getting seriously ill goes way up once they leave our communities. So I would advise that people not rely on herd immunity as a reason for not getting vaccinated.
Great. And I'm happy to talk about side effects. We are very fortunate that we have data from decades of vaccines that we've given for many different diseases. And the side effects that we see with vaccine are usually short-term side effects. And they're side effects that we had talked about, the fever and the fatigue and the muscle pain, headaches. And with the COVID vaccine, it's similar. We have those side effects, but we also have tens of millions of people that have received the mRNA vaccines over the last year. So we are able to see that they do have short-term side effects, and there is a very small proportion of people that have the medium-term side effects of the myocarditis, but it is, again, rare. And it is what we call self-limiting, that it will go away with supportive treatment with anti-inflammatories. The vaccine does not enter the powerhouse of the cell, the DNA. It does not change DNA of any of the cells in your body. It does not get into the DNA. It does not cause infertility. It does not cause fertility problems with men or women. So I think going forward, I think the most important thing to know is that this has been studied very well. We've had decades of experience with other vaccines, and we really do think this is safe and not going to have long-term complications.
Thank you. I think this is a good question too, and one that we maybe will be glad to no longer have to run back into the house to grab our mask. Once our children are vaccinated, will they still have to wear a mask? Will that be required of them?
So I'll take that. I'll start with that response. So we're still, Monterey County is still aligned with the California Department of Public Health in terms of health officer orders and guidance on just about everything. But in particular, it's the aligned with the school guidance that came out from the state. And so I know we have Monterey County Office of Ed here as well, but as for now, the recommendation out of the guidance that's a requirement that includes both public and private schools here in Monterey County, is that the children, while they're in the classroom, must continue to wear a face covering. And I know that the state was going to reevaluate that right about now, beginning of November, I believe. But at this point, I haven't heard any indication that the state is planning on removing that requirement in classrooms.
One parent wants to know what the options are for those parents who decide not to vaccinate their children after the deadline. Is homeschooling going to be available? Is that going to be provided if they choose not to vaccinate their child?
Correct. So we would move it into an independent study model at that point.
One parent says, my doctor believes it's too early for my son to receive the vaccine because of the lack of the longevity, long-term studies, they say. I'm wondering why he disagrees with doctors on this call. Anyone? What would your argument be to that doctor that spoke to this parent?
I would like to say that I think the person that is most able to talk with families, parents, and children are the primary care physicians and providers, the pediatricians, family medicine doctors. There are some children that have disease processes that may not be best to get the vaccine, and their doctor is going to know that. So I am often asked questions in public forums if a child should get a vaccine, and I always refer the child back to their primary care doctor, who knows them very well, knows their medications, knows their potential problems that they might have, and can have that conversation with them. So I would never disagree with one of my colleagues that is speaking with their patient. And I think it's best that the parents talk with their doctors and make these decisions with their trusted medical professionals.
Okay. Dr. Carpenter, this next question from Alvita, I think you touched on it earlier. You were saying the vaccine doesn't change the DNA, but they're asking about affecting fertility.
Yes, the vaccine. So we hear the term mRNA, and this is something that helps your body, kind of jumpstarts your body to be able to start producing antibodies. So it cuts out the middleman in some of the other vaccines that enables your body to make antibodies to COVID. And this mRNA is not very stable. It is broken down very quickly in the body, and it is eliminated within days. So this does not stay in the body, and it does not go into the cell's powerhouse, which is called the nucleus, where the DNA is stored. And the DNA are the genes that allow your body to do all of the things that it can do. And it does not go into the DNA of cells of the body or the cells for reproduction. So it does not cause infertility.
I'm going up to some of the questions I may have missed, and I spotted one here. One parent wants to know, I understand that the Pfizer vaccine is going to be available soon, in November. Is the Moderna vaccine expected to be available for the age group 5 to 11 as well? If so, how soon? I guess adding to that, is there a difference?
doctors, I will defer that one to you guys. I am not sure.
Yeah, so I would just say I don't know when Moderna is planning to present their data to the FDA. So we'll just continue to track that with the California Department of Public Health to see what progress they're making in requesting authorization from the FDA.
Yes, I have reviewed extensively with Pfizer, but I have not seen data about Moderna.
Okay, and sprinkled throughout the questions here in the chat, I see more than once parents are asking where to go to find information on the vaccines, on the trials, on the side effects, sources that you can provide for them.
I would have maybe just one suggestion, that is the FDA does have on their website fact sheets for, I think, one for parents, one for healthcare providers on the vaccines that have been authorized. It includes not only what COVID is and what the vaccines are and how to administer the vaccine, but also provides some information about the studies that were the trial results in terms of side effects, for example, in those as well. And maybe I could work with Maya later to maybe somehow try to make that available.
Also, the American Academy of Pediatrics, who is a fantastic advocacy group for children, has resources for both providers and for families.
Okay, I see we're close to our end time here, but I guess I'll let our panelists end with just maybe a short message to parents who joined today, and your message about the vaccine that is, soon approaching availability for them, and what you say to parents who are showing concern and hesitancy surrounding it.
I'd like to say thank you for your great questions and for listening. If you have questions and concerns, please reach out to your primary care provider for your children. There are fantastic doctors and nurse practitioners and physician assistants all throughout the county that are great advocates for children and great advocates for your children. So please feel free to reach out to them for questions and concerns. We're here, always here to help.
In Monterey County Office of Education, our interest is in the well-being of not only the students but also our staff. And as soon as the vaccine is available, we will let you know about these clinics. So they're close and accessible to all of you.
Yeah, thank you. I'll just add that I and my team in public health have worked tirelessly to do what we can, working with partners to educate and inform the community so that people have what they need to make their decision. And hopefully that decision is to get vaccinated and get their kids vaccinated. I do agree that your primary care provider is an excellent source of information. They know you, they know your kids. They can consider things that other people wouldn't think of because they don't know your children as well as they do. So consult with your primary care provider.
Okay, thank you. I don't know if our elected officials want to say something quickly before we end here.
Yeah, I just want to thank everyone for this great panel, a lot of good information. And we know this is a start. We're going to have to keep educating parents as more information comes out, more details about this mandate. But I really want to thank the people of Monterey County. We were one of the hardest hit counties in the country. We've really progressed a lot because of some of the steps that we've all taken, including most recently the CDC transmission rate. We improved from going from high to substantial, now moderate, one of only 4 counties in the state that have progressed to that, but it's because we're all doing our part. So thank you very much, and I'll pass it to my other elected colleagues.
Thank you, Veronica, so much for hosting us tonight and for giving parents a chance to get more information. Dr. Moreno, Dr. Carpenter, we are so lucky to have caring individuals like you who are in our community to help answer questions. Esmeralda, MCOE has been just a phenomenal partner. And to all the moms and the dads out there, I get it. Like, it's hard. I'm in it too, and it's been a rough 18 months. And you know, these are conversations that I'm not just having with my partner about how we're going to make decisions for our children. I'm having these conversations with my child as well, and my mom and my sister and my nieces. And really the only way that we move past this pandemic, the only way that we move into a space to keep each other healthy and safe is through vaccinations right now. And so I'll be waiting and watching for news anxiously, and my family will be there when our turn comes to get vaccinated for my son. And he's excited and I'm excited, and we look forward to big birthday parties again, and big community events at school, and being able to, you know, run and play in the street with our neighbors without having to think twice about who's been exposed or what variants are floating around in the community. So thank you all so much for your work to care for our community, and we're going to come out the other side of this, but only when we continue to take care of each other. So thank you again.
And I'll just acknowledge and echo my colleagues' comments, and just plain old say thank you. I'm sure half of you are cooking dinner, trying to get food on the table for your kids right now, and would rather be doing other things other than be on a Zoom meeting from 5:30 to 6:30. But good on you for getting the education and the information necessary to make good decisions for your family. So thanks for being here.
Thank you, everyone. And from KION, I just want to say thank you for joining us. And hopefully you take something from here today that, you know, if you were on the fence, maybe this helps you take some information here that makes you have a better informed decision. And thank you for joining us today. Have a good evening. Bye, everyone.